Good morning, everybody. This is Dr. Dan Kraus from Terrapin Care Center. Today, I want to talk to you a little bit about motor vehicle collisions and the effects that these collisions have on our spine. Quite often, we get patients that come through the door that don't realize how injured they are. I'm standing in front of our digital x-ray here. This is a vital tool to be able to properly diagnose the damage that's done after a vehicle collision. I'm intentionally not using the word accident because most of the time it wasn't an accident. Someone collided into you, okay? That's not an accident. This was a collision. Someone hit you. It's not your fault, and you're injured. So that is not an accident. That is a collision. It might seem like I'm splitting hairs here, but it matters. I think if you use the word accident a lot, it minimizes what's actually happened, and this is a traumatic injury. We want to make sure that we document this injury thoroughly. One, because a lot of times these things end up going to the attorneys and they have to duke it out with the insurance company. My experience has been that the attorneys do a great job, but they can only do their job if they have the proper amount of data to be able to support the diagnosis. This x-ray behind us is a vital component of that. Not just in standing weight-bearing x-rays, normal static x-rays, but also flexion and extension views. And the reason why we do that, when we look at a normal x-ray, if someone hasn't been in a traumatic injury, we might not do flexion extensions. And we get a lot of information just off of this. But once we put the spine into motion, we bring the head forward and take an x-ray, and then we bring the head backwards and do the x-ray. We can see here at C3, this patient has ligamentous instability, which just in a static x-ray, you can't diagnose that. So this may even warrant further study, MRI, or even what we call digital motion x-ray, DMX, and we can facilitate that for you here. The more information that your attorney has after a collision, the better your chances are you're going to get what you need from your insurance company to be able to pay for your care now and also future care you may need as a result of a collision that was not your fault. So we go that extra mile. We want to make sure that we get the diagnosis thoroughly. How many of you have been in an accident? See, I even say it sometimes. Collision, right? It wasn't your fault, or even if it was your fault, and your neck was never the same. But you never had an x-ray. You never had it properly diagnosed. And a lot of times, you never had the proper alignments. You never had the proper traction. You never had the proper care going forward to address the ligamentous instability, because this isn't a couple of weeks of care. This is months of care to be able to get you back to where you were, if it's even possible to get you back to where you were. So please, do your diligence. Make sure that your practitioner is taking x-rays of your spine after a collision. Absolutely, you need to know. To see is to know, not to see is to guess. Why guess with something that can be chronic, degenerative, and debilitating over time? You don't want to have long-lasting effects from something as simple as, like yesterday, we had the snowstorm that came through. As I was driving home, I was thinking about it. How many people are going to get into collisions today? How many people are going to actually end up in a chiropractor's office or another practitioner's office where they shoot spinal x-rays to check for damage? How many of those are going to do flexion extension views to be able to see what is the damage that's done here? Is there instability in the spine that needs to be addressed? And sometimes that needs to be addressed by a neurosurgeon or an orthopedic spinal surgeon. Hopefully that's not you, but sometimes that's the case. And if we don't take these images, we won't know. So we're here to help. Even if it's been years ago where you're like, you know what, I was in this collision and I've just never been the same. My neck has never been the same. I've been getting headaches ever since. I can't sleep right. And every so often it becomes debilitating. I can't even turn my head one way or the other. Don't ignore it. Don't just pop pills. There can be a solution here to actually restore the proper structure and the alignment and rehabilitate you so this doesn't become an ongoing pain syndrome for you. Please, we're here to serve. Give us a call, 301-220-1930. I'm Dr. Dan Kraus at Terrapin Care Center, and we look forward to speaking with you. Have a great day.